Interdental brushes are small, cylindrical, or conically shaped brushes that scrub in between teeth, where most periodontal and tooth decay problems start. Interdental brushes are manufactured in many sizes, shapes, and different qualities. Most are fabricated with short handles, which can be easily carried for use throughout the day. Versions are also made with longer handles and replaceable brush tips. Better brands have plastic-coated wires, which make them gentler on sensitive teeth and safe to use around implants. Although the surfaces between the teeth conceal only about 40% of the tooth surface, these areas account for about 80% of the problems. Toothbrushes will not reach these areas. By paying extra attention to areas in between teeth, where problems usually go unnoticed, you not only reduce your chance of tooth decay, root canals, and crowns, but you substantially reduce your tendency toward periodontal problems. Compared to floss, where space allows, interdental brushes are easier to use and much more effective. Most people find floss awkward to use and become even more frustrated as it becomes difficult to maneuver around fillings and bridges. Most will agree that when you want to clean something well, rubbing with a bristle will be more thorough than a piece of string. In between back teeth are concavities called furcations. Floss cannot reach into the depths of the furcations, whereas interdental brushes have bristles which fan out into them. Interdental brushes can reshape the contour of the gums between your teeth, making them healthier by reducing hidden areas called periodontal pockets. For that reason, they are particularly useful after pocket reduction gum surgery. In areas where the triangle of gum in between teeth, called the papilla, is essential for cosmetic appearance, perhaps around the front teeth, floss may be preferred. However, with various sized brushes ranging from extra small, even these areas can usually be adequately accessed without changing the appearance of your smile. In areas of dental crowding or very thick gums, even the smallest size may not fit, and dental floss is suggested. Use light pressure to insert the brush straight, 90 degrees, in between teeth with a gentle wriggling action. Sometimes a slight bending or curving of the wire will allow for the proper angle, especially on back teeth. Ease the brush in. If the brush is pushed too hard or the wrong size is used and the wire buckles, discard the brush. Be careful not to overly stress the wire to avoid breakage. Choose the largest size that inserts without force. The correct size should fit snugly but easily. Move the brush back and forth between your teeth, implants, and under crowns and bridges. Orthodontic patients can also use interdental brushes as they slide between the arch wire and the tooth and remove plaque from around the brackets. It's a simple skill to learn. Stay with it for a few days and you'll become more aware of how to angle the wire and shimmy them between your teeth. If the wire gets wedged between the teeth, gently find the wire with your fingertip on the tongue side and push it toward the gum line and withdraw it by pulling it straight out. Sometimes floss can dislodge it as well. If an interdental brush is carefully taken care of, it may last for a few days. Like toothbrushes, you can wash them out and reuse them until the bristles deteriorate or the base wire has been bent too many times. If you prefer, you can dispose of them after a single use. Although this may cost more than less effective oral hygiene aids, it is far, far less than the costs associated with dental treatment. Unlike a toothbrush, you can keep an interdental brush in your pocket and use it in many situations where it would not be suitable to brush. You should always have one within reach.